Is government health care a healthy choice? Stay tuned. Hi, I'm Sue Jeffers for Libertarian Viewpoint. Libertarianism is all about liberty, the exercise of freedom that doesn't impinge on the rights of others. We constantly hear the drum roll of government solutions. This show's purpose is to allow you to see for yourself why non-government solutions are a better alternative. Today our guest is Twila Brase. Welcome, Twila. So glad to have you here.
Thanks, Sue.
You're with Citizens Council on Health Freedom. Will you tell us a little bit about your group?
Yep. Citizens Council for Health Freedom, or CCHF, is a nonprofit healthcare policy organization that focuses on freedom. So we are focused on supporting the patient and doctor freedom, medical innovation, and the right of citizens to a confidential patient-doctor relationship. Our goal is health freedom for all.
And you were named in the top 75 most influential people in healthcare in the whole United States a couple years ago, right?
That's correct. That was a surprise.
That is quite an honor.
Yeah, it
so
was.
You are just the expert we need to talk about not only some issues having to do with healthcare in the state of Minnesota, but to also talk about Obamacare. So Obamacare is in front of the Supreme Court. We should have the ruling in June. But let's talk about Obama. Let's back up 2 years ago when it was rammed down our throat. You didn't have to wait for the bill to be passed to find out what was in it. You actually read the bill. Will you tell us a few of the things that are in it and why we so adamantly oppose Obamacare, the law of the land?
Sure. Yes, and that's an unfortunate thing that everyone says it's a law of the land and we just have to follow it. And I think that, there's a lot of things that people have decided not to follow because they thought it actually wasn't constitutional, and that states have decided not to follow because they didn't think it was constitutional. But some of the things that are in Obamacare that we need to think about are the fact that there are essentially 18 new taxes. There are penalties on employers who don't offer health insurance. There are penalties on individuals who choose not to buy health insurance. There are sort of a head tax that's supposed to go for research, and that research is going to end up in coming out with protocols that are meant to ration care. That's what we believe. There are at least 2 committees that we think will ration care. One of them is called PCORI, the Patient-Centered Outcomes Research Institute, and the other one is called IPAB, the Independent Payment Advisory Board for Medicare. There are approximately, I'm trying to recall the number, but I think it's 169 new government bureaucracies. There's the Health Insurance Exchange, which is essentially a federal command and control center to be established in every state, a website portal through which data will flow back and forth and control and monitor healthcare at the federal level. There are all sorts of new unelected bureaucrats. There is the IRS, who's going to have policing functions. They say 16,000 new IRS agents to make it all happen and make sure that we all purchase health insurance. So there's 2,700 pages, and I'm now sort of spewing this off the top of my head. But I can tell you that I heard from Congresswoman Bachmann's office that there's already 11,000 new pages of regulations. So for the exchange itself, the first final rule from the exchange is 644 pages. The second one is 167, and the third one's yet to come, and then there are about 6 more. So there are thousands and thousands and thousands of pages that are going to come out of that 2,700 pages of a law.
So think about this. You've got 3/4 of the people of the United States of America who want to see Obamacare, all or part of Obamacare, repealed. And we can't count on the Supreme Court to do our work for us. Shame on us for allowing this to be rammed down our throats. Elections have consequences.
Correct.
And I don't think people understand when you talked about all these pages that bureaucrats are writing to interpret what this law says, I don't think people understand that bureaucrats are deciding our health care.
Right. When attorney Jonathan Emord came and did our event last November, he made it clear that the bureaucrats write essentially 9/10 of our law, which means that if Congress wrote a bill that was 2,700 pages, now multiply that by 10, and that's the number of laws that we will have out of that one bill. Bureaucrats have the power of rulemaking, and so let's just say that the law says there shall be a health insurance exchange. Then the bureaucrats go and figure out exactly how to make that happen, and they write all the rules to make that happen. They are unelected. They ask for our comments, but they don't have to listen to us. And then once they finalize it, then that is the law, essentially the law of the land as well.
One of the arguments that I hear in favor of Obamacare all the time is, well, we make you buy car insurance, like it's even the correct analogy, but tell us why that's wrong.
Well, several reasons. One is car insurance is a state mandate. It is not a federal mandate, and the Constitution is of limited powers, enumerated powers for the federal government. And here the federal government has overstepped its bounds outside its enumerated powers to tell all the states and all the people in the states what they have to do. But those powers are reserved to the states and the people alone. So that's one reason. Another reason is you don't have to drive a car. You can take a bus, you can walk, but this impacts absolutely every person being forced to buy health insurance against their will.
And I take it even one step further, because in this case, it's government telling us what kind of car we have to buy.
That's true too.
Because
Yes.
they tell you this plan is acceptable, and you have a couple, 3, 4 choices, and that's it. How can government be allowed to step in between the decisions between patients and doctors?
Right. It's bronze, silver, gold, and platinum are the levels in the exchange that you're going to be able to buy. And some people are going to say, well, that's only going to be for the people on Medicaid and Medicare. But really in the exchanges, it's everybody who is a individual who wants to buy their own coverage. It's small businesses. And we believe that the large businesses will say, you know, we're out of here. We're just going to give our people money and send them into the exchanges, and then that's going to be available is whatever the government says. And a person should be really concerned because of even the whole thing that has happened here with the contraceptive mandate. That is just the beginning of the government deciding what you will pay for and what you have to pay for. That is just the beginning of the mandates.
One of the other parts included in the mandates is insurance companies have to provide all this preventive care, and it's free. Isn't that awesome? It's free.
Yes.
It's not really free.
There's nothing that's free. And so what's being required here is for our insurance policies to go higher in cost. I think it's interesting if you remember that the president said that if you like your health insurance policy, that you'll be able to keep it. And I think one of the best reports that's been done that I have ever seen is by Galen Institute, which gives specific scenarios already happening as a result of Obamacare, where 20,000 people here got dropped, 200,000 people there got dropped, etc. You know, all these people are losing their coverage because of the additional regulations, because of the additional mandates, because of the additional costs.
President Obama also promised to bend the cost curve down, and we just got some new numbers out of the CBO, and they said, oh, yeah, well, we told you it was only going to cost under $1 trillion. Now it's going to be almost $2 trillion. Some of us think it's going to go up to $3 or $4 trillion. So they lied about how much it's going to cost, too.
Well, that was a political strategy to make sure that they could get it passed and say they had, done it under $1 trillion. But they only counted the first 6 years of the law actually being in operation. So now the CBO has come out and they have calculated the first 9 years. And so now it is up to 1.76 trillion. But wait till next year when they have the full 10 years. And that's just the first 10 years. It's not like it's all going to stop after 10 years. So how much is it going to be after that?
Right. That number is going to get bigger and bigger and bigger and
That's
bigger.
correct.
Okay. You were talking earlier about these health insurance exchanges. Can you explain to people what that means?
Well, a health insurance exchange is a new bureaucracy, but I think the way that people should be thinking about it is more like it's a website portal. It is a URL to go to, but you have to think about everything that's going on behind the screen of your computer as you tap into that portal. So the exchanges will control what kind of insurance is available. They are responsible for actually monitoring healthcare quality in the state, which means getting into the doctor's office. They are the ones that will share data with 5 different agencies of the federal government, with the Department of Justice, the Department of Treasury, the IRS, HHS, the Social Security Administration, and Homeland Security.
Wait a minute. My information is going to go to the Department of Homeland Security thanks to a health insurance exchange?
To make sure whether you're a citizen or not. It's going to go to the Social Security Administration to see whether you're alive or dead. So that's
good to know.
That's checking for fraud, right? The exchange is also going to expand dependency on the federal government, because there are subsidies in there that are meant to mask the increased price of health insurance, so that anybody with 400% or less above the federal poverty guidelines, which is a family of 4 making $88,000, is able to get a subsidy from the federal government, which of course is paid for by our tax dollars, right? But what that really does is it makes an increasing number of people dependent on the federal government to pay for their health insurance. So we have increased dependency and increased entitlement through the exchange. Then of course there's the cost of operating the exchange, which is about $30 million a year, which will be either through increased taxes or through user fees on the health insurance plans, which means it will increase your premiums, right? And then there's just the fact that the exchange has to follow everything that the feds say it must do. So the first regulation, as I said, is 644 pages. The second one is 167 or 176, I can't remember. And there are, both those regulations promise more exchange regulations to come. So I think when you think of the exchange, you should think of it as the federal takeover center. It is a website that gets installed by the state government in your state, and if the state government refuses, the feds are building a website portal for you to go on through the computer, and that will grab all your data, send your data back, tell you what your choices are, tell you automatically enroll you in Medicaid if you qualify even though you don't want to be. And then it will do the whole subsidy things. It will monitor whether or not you have purchased insurance as the government requires, and then it will penalize. It provides the opportunity for the IRS to penalize you.
In a minute, I want to get into what Minnesota is doing with the health insurance exchange, but I want to wrap up our comments on Obamacare as the law of the land. We want to see it repealed. We want to see the Supreme Court overturn it, that it is an unconstitutional law and the whole entire law should go. Let's say that does happen. What are some free market health care ideas that we could use that would reduce the cost of health care and would actually be better for the citizens of the United States and for patients in general?
Well, I think we need to start looking back at what insurance is meant to be. And insurance is meant to be for the catastrophes, for the risks, the financial risks that you cannot prepare for the $1 million baby, for the $2 million cancer, whatever. That's what insurance is supposed to be about. But insurance has moved to a third-party financing mechanism. It'd be like asking somebody to go out and buy your groceries, and you prepaid them, and then they go out and buy your groceries, and that's just a financing mechanism to buy something. Insurance is supposed to be for the catastrophe, so we should be paying for routine and minor care all on our own. We should be paying cash. If we were paying cash, then the prices of everything would shrink. I like to tell people that the prices of today do not have to be the prices of tomorrow. As soon as we actually got cash into the system and we got all the bureaucracy and the paperwork out, everything would change. People would post their prices. Doctors would talk about what they've done and what they haven't done, and there would be a real competition. So I think we need that, and then I think we need to look at how do we actually come to a point where we can keep our policies until we die, rather than being dependent on Medicare and whatever political decisions are happening at the federal level. So I think it's about cash, and it's about reinstalling charity and reinvigorating charity and seeing the value in it. We could have charitable hospitals that are truly nonprofits. We could take away the nonprofit status of all the other hospitals who have just become big businesses. And we need to open up the market to real insurance. One of the things I didn't mention is that Obamacare actually outlaws true insurance. The only thing that is left are managed care, third-party payment, no deductible, well, deductible policies, but really expensive doing all the preventive care, which is not what insurance is about.
Which is exactly the wrong way to go, the wrong way to go.
Right.
So at the state of Minnesota, we have a lot of things going on there too. And shockingly, we have some Republicans who are trying to institute a health insurance exchange in the state of Minnesota. They've already gotten, what, $30 million? And are spending it to set up this exchange, when they should be fighting against this ridiculous legislation?
Well, to be fair, it is the governor and his administration that went after the $31 million, and I'm sure that they want even more. And the only way they could get it was either to have a law passed or to have an executive order. So the governor did an executive order, and now he is hoping beyond hope that somehow he's going to get legislative authority through the legislature. And we, of course, are hoping that he does not, and trying to make sure that that does not happen. We do have some Republicans who signed on to a Democrat bill, of just pure exchange bill, and they were chairs of three committees: Tax Committee, Commerce Committee, and Health and Human Services. So they signed on in support of the health insurance exchange. And I like to tell people it's a government exchange. There are lots of private exchanges already: eHealth Insurance, Bloom Health, Medica has their own. It's called My Plan. So there are lots of exchanges, and they are private exchanges. But this is about the government, and this is about taking the Obamacare legislation in and bringing it into Minnesota and installing this federal takeover center in the state of Minnesota.
So you actually have Republican chairs who signed on board with a Democrat bill to implement Obamacare in the state of Minnesota. With friends like that, who needs Democrats? I mean, seriously, why would these Republicans sign on board with that?
Yes, and I don't know that all their colleagues were in support of them. Right? I don't know that that was the case, but I did find it interesting in an election year that they would actually choose to do that.
I think it's absolutely outrageous that we are even considering to implement anything into the law for the people of Minnesota that would help further Obamacare.
Well, and there are plenty of other bills where it is far less obvious what is going on, where it doesn't say exchange, where it says one little piece about the federal law. But all of this, for our, as far as we're concerned, all of this could be all that the governor needs as his cue that he has authorization, and that we don't want any of those kind of pieces of law put into place.
Why are they being so sneaky? I'd even go so far as to say being traitors.
Well, I know that the Chamber of Commerce and the health insurers and the insurance, not all the insurance agents, a lot of agents actually don't want it, but the organization for agents have been pushing for the health insurance exchange. They all sort of have their own reason. I think the Chamber probably wants it because business wants to be able to drop employer-sponsored coverage and just put them all into the exchange. And I think that health insurers see it perhaps as a cartel maker. Once they're in there, then they can increase the prices. And only they will get in there. The little guys won't be able to deal with all the regulatory morass needed to stay in there. And then I think that the insurance agents want it because of how, not all of them, again, not all of them, but the big players, because of how last year they were going to get their own chit. If the exchange went in, they would be the only navigators under Obamacare, and not anybody else could be a navigator. And that was their plan last year. And I think, I think there's still something going on this year. So there's different reasons why different people want it in.
They think they can save themselves at our expense.
Right, at our expense, right.
At our expense.
It's very bad. You should never put the government in control. You shouldn't let the federal government come in. This is the heart of reform. The exchange is considered the heart of reform. If the states refuse to do it for President Obama, it is very hard for the federal government to control healthcare in a state. So this is why it's really important for us to stop it in every way that we can.
Anytime you have government coming in and setting up any kind of bureaucracy, like a health insurance exchange, we're no longer talking the free market.
Right. And the thing is, there's no difference between the, quote, state one and the federal one. It's all a portal. It's just a portal on your website, a URL that you go to, but it's the guts of what's happening behind it. And either the federal portal or the state portals, they all have to follow the same law and the same rules. So this is not going to give the state any control, and that's how they're selling it. They're like, well, we can make a better one than having the feds come in here. And I'm just here to say that they all have to follow the same law, the same rule. It's just that the feds really don't want the people of Minnesota to know that it's the feds, that it's really a federal portal, because it's all the federal rules, all the federal law. It just has a Minnesota on top of it. And that's just a way to sort of, that's a way to deceive the public.
It is deceitful.
It would be better for everyone to go to the federal one and have it say U.S. Department of Health and Human Services so they could actually see the national takeover of healthcare than have it say Minnesota and think, oh, well, this is just a state thing.
And see that we're only going to be allowed to buy, only going to be forced to buy 4 policies: silver, bronze, platinum, and gold.
Gold, yep.
It's crazy. It's insanity. What else is happening over at the state legislature that we should be worried about?
Well,
or happy about?
There are few things to be happy about, even though the Republicans are in charge. And so we are regularly opposing what they're doing. There is, for instance, there was an attempt by Senator Julie Rosen in Fairmont, a Republican, to expand the use of the data that's in the data warehouse in Maine. So all of our information is being sent by our health insurers to a data warehouse in the state of Maine, where it is then considered owned by the Minnesota government, and then it is analyzed, our doctors are analyzed, scorecards are kept, and payment reform happens, which means that they can have their pay cut if they don't comply with the way the government wants medicine to be practiced. Okay, so she was intending to expand how that data could be used, all without anybody's consent. And she was also trying to put a piece of Obamacare in there, which is the fact that Obamacare requires the states to create a risk score on every individual, so that we would be our weight, our blood pressure, our lifestyles, whatever they would decide to use as to say what kind of a health risk we are, therefore what kind of a financial risk we are to the health plans. And this is one thing that Obamacare requires. And so she wanted to use the database because Obamacare says if you had that kind of database, like in Maine, you can use this to create risk scores on all your people. And so she had to scale back on that when it wouldn't get through the committee, but we still believe that there will be an attempt on the floor to put it back in.
Oh, you can count on it. I trust these people as far as I can throw them, and Julie Rosen is one of the worst. That wasn't the only data bill that was over there. There are several of them that are passing through all kinds of other committees, whether it's the judicial or public safety or whatever. So
Yep.
we always have to watch out for what they're trying to get away with our
Right.
data. They forget that it's our data.
Yeah, they don't actually think it is. And they think as long as our names aren't attached to it that they can use it. But the fact of the matter is when you take somebody else's data and you have the power and the resources to make it look like you want it to, you can push policy. And it is actually against our rights to use our data to push policies that may in the end harm us. We should have a right to decide whether or not we want it. And actually we should have a right to decide whether or not they get it. Not just whether they can use it once they've got it, but whether or not they can get it.
Right. What else is happening over there that we should be worried about? Or, well,
Yeah.
okay, we know there's nothing to be happy about over there, but what else should we be worried about?
Yes. Oh, actually, there is one thing to be happy about.
Oh, good.
Yes. The Republicans are trying to do some changes to rulemaking, trying to put some limits on the agency's ability to make rules. And this is a good thing, and we have testified in support of those bills. And I hope that all those bills pass. I don't know whether the governor will sign them or not, but I certainly hope they pass.
It comes down to, will Governor Dayton sign them?
That's
And we
right.
have to pressure him to sign them too.
Right.
Right.
Right. Yeah. Then there's baby DNA.
Oh, I want an update on baby DNA because we're still working our way through the courts with that.
Right.
Baby DNA, start at the very beginning for people who aren't up to date on this one. When the baby's
Okay.
born, the government comes in.
Yep, when the baby's born, the government sends in the nurse or the lab tech from the hospital, and they prick the heel of the baby, and they take a few drops of blood and they put it on a card. And in Minnesota, there's a card that's about yay big, and it's got 5 dots of filter paper on it. And they fill those filter paper dots, and they don't. Yes, they take it to the lab, but they do nothing at the hospital lab. They send it directly to the health department, to the state government. Then the state government takes 2 of those blood spots and sends it down to Mayo Clinic. And then Mayo Clinic does part of a newborn test, which we call a genetic test, and the health department, the state government, does another part. Then Mayo keeps the 2 spots and the health department keeps the 3. And so that has been where it has been for a long time. Then they give the newborn genetic screening results to the doctor, and then the health department has been keeping the blood spots, keeping the DNA of the baby, and they have also been keeping a register of all the results, whether they found something or they didn't find something. Every child has been registered in the database. And when we discovered this in 2003, we said, there's no law that allows you to do that. The only law that's out there says that you can do this test, you can report the results, and you can keep a registry only of the children where you actually find something wrong, find a condition, find a disease, right? And so for 8 years, we have battled the health department. We got an administrative law judge who said that the health department was violating the state's genetic privacy law. The state's genetic privacy law says that you cannot collect, store, use, or disseminate genetic information without the informed written consent of the individual, or in this case, the parents of the child. And so the health department tried for 3 years to exempt the newborn screening program from the genetic privacy law. They were unsuccessful. In 2009, we got some parents together with a lawyer, and they sued. 9 families sued. And on November 16th of 2011, the Supreme Court ruled in favor of the families and said that indeed the health department never had any authority ever to do the storage and the use beyond newborn screening. And now, since the genetic privacy law began, they are violating the law. So here we are, but shortly thereafter, so they sent it back to Hennepin County for damages and to figure out exactly how that would look. And then 2 class action lawsuits were filed by 2 different groups of families. And so now, rather than all of those blood spots, 14 years of blood spots, almost 1 million children's DNA, which is sitting in the health department, all those blood spots are on hold, waiting for those class action lawsuits to run their course. And the genetic test results are on hold. But the health department now, for any child that was born starting November 16th, 71 days after their birth, all of that is then, the DNA is destroyed. The test is kept for 2 years, and then that will be destroyed because that's from a federal rule.
So the most important thing for this is, once again, government got out of control, took the baby's DNA, and the most important thing we want to remember is written informed consent. That's our DNA, not the government's DNA.
Yes, but I think even more important than that is that I testified recently on a bill to say I don't believe that the government has any right to keep it even with consent. Because what I fear is that parents will give consent. This is a very vulnerable time in their life. Why is government even thinking of keeping a database of children's DNA? I don't think this is a place that government should be. And so I think that they shouldn't even be asking. They should do newborn screening. And then if some private entity wants to create a database for children, that would be a different thing.
Exactly right. Keep fighting, Twila. Thank you so much for joining us today. I really appreciate it. Well, we're out of time. If you find yourself agreeing with our guest, you might be a libertarian. To find out, take the world's smallest quiz at www.theadvocates.org. Remember, Libertarian Viewpoint brings you the non-government, liberty-based solutions that other media refuse to tell you about. Liberty works, and it is always the best choice. If anyone in government can prove otherwise, I challenge them to speak up. To view past shows, search YouTube using Libertarian Viewpoint. Thank you for watching, and stay tuned for other shows of Libertarian Viewpoint.